Long term, we have an enormous challenge in that the number of healthcare providers is just not keeping up with the number of patients that need help. So a growing percentage of our population will be over 65. And this is not just true in the United States, but worldwide. The number of people graduating from medical school and from nursing is going up much slower than the need for healthcare providers. So we, by necessity, will have to find a way to help more people with less resource. And that's where technology, AI, and many other things will have to come into play. So most of healthcare actually doesn't really happen in the hospital. That's where you attend to people when they're most sick. But after you leave the hospital, people have to manage their symptoms at home, often with the help of family caregivers or other support networks. Understanding how to help patients at home and be able to stay connected with them to see how their disease projection is happening, whether they're getting better or worse, is really important. And that's where remote patient monitoring, patient education, verified tools such as AI that they can use at home will tremendously help people not only get better outcomes, but better quality of life. Patients are already asking for their data. They're using different kinds of AI tools and getting advice from these tools. I think it'll be important to make sure that the experts, doctors and nurses, stay in that loop and that we don't just throw technology off that gets misused. And so building these digital ecosystems that go beyond the hospital walls will be really important. It's a time to be creative, to be able to find new ways to help people, to be able to give them best quality of life with the resource, both financial and the human resources that we have.